Bonjour.
Hello. Hello
Hello
everyone, welcome on OHS Forum. You're already familiar with this forum. It was launched last April 6th, and today it is the operational launch of the international working groups. I need to remind you that this is a group approach. It's inclusive, it's cross and multidisciplinary. This is the key of One Health. We analyze human, animal, and environmental health. Last April, we told you that we would actually launch different international working groups. But before that, we have a key message from the FAO and the OHS.
I would like to thank you for inviting me to address you today. Our world is facing increasing threat from the risk of epidemics and pandemics, climate crisis and environmental contamination, biodiversity losses, and ecosystem degradation, among others. Natural resources are under pressure due to a growing world population, unsustainable agri-food system, and a rapid urbanization. If left unchecked, these global challenges will have devastating consequences for humankind and our capacity to feed the world. The complexity and the interconnectedness of the challenges require the broad paradigm shift, embracing structural solutions with a great emphasis on upstream prevention. We must rethink our relationship with nature. We need to embrace collaboratively, collectively, and a multi-sector and transdisciplinary approach to move forward. We must build a partnership, alliance, and coalitions for science-based and green solutions to transform our agri-food systems and keep our planet healthier. These efforts are crucial for achieving the 2030 Sustainable Development Goal Agenda, with the overall mandate of ending hunger and alleviating poverty. Underpinned by the aspiration for better production, better nutrition, a better environment, and a better life, leaving no one behind. FAO promotes the transformation to more efficient, resilient, inclusive, and sustainable agri-food systems. One Health, as a systematic approach, links human, animal, plant, and environmental health. It seeks to optimize balance across sectors and systems, prevent long-term health risk to people and animals, achieve the food security, and preserve natural resources. The approach is gaining traction as a core strategic area within FAO for better vision. And we are working with OIE, WHO, plus UNEP, and others on the developing a global plan of action on One Health. The plan is a joint commitment for collective action to implement One Health at global, regional, and national levels. Our timeline is ambitious, but agency and political willingness shall propel us to move fast to ensure sustainable One Health for all. Thank you.
Nous venons d'entendre le directeur général de la FAO exprimer l'importance, l'urgence de travailler de façon transversale sur les enjeux de la santé, cette santé qui prend
He just repeated the necessity to have a cross and interdisciplinary approach. We have another message from the General Director of the World Health Organization.
Distinguished guests, dear colleagues and friends, my thanks to Secretary General Benoit Miribel for the invitation to say a few words. The health of humans, animals, and planetary ecosystems are closely intertwined. Changes in this balance can be a catalyst and a threat multiplier, exacerbating the growing global burden of both infectious and non-communicable diseases. The recognition of this interdependence has prompted the search for solutions using a One Health approach that addresses the intersection and interdependence of humans, animals, and the environment, including climate change. The emergence of COVID-19 has underlined the need to strengthen the One Health approach, as well as promoting a healthy and green recovery from the pandemic. Until now, implementation of this approach at the country level has not been sufficient. We need to better operationalize policy responses, strengthen country capacities, and better monitor risks and preparedness for early detection and response to emerging pathogens of animal origin. At WHO, we have established an organization-wide initiative on One Health. We're also working on a multidisciplinary initiative with the Food and Agriculture Organization of the United Nations, the Organization of Animal Health, and the UN Environmental Programme to convene a One Health high-level panel of experts. Working together, we can build the safer, healthier, and greener world we all want. I thank you.
Voilà, vous venez d'entendre deux messages de soutien.
You've just heard two very important messages from the FAO director and the WHO director. Obviously, we need to react urgently, but we also need to work in the midterm in order to find global health answers. You are connected on this YouTube channel live for the launch of the operational launch of our forum. They will be presented in details. First and foremost, I'll ask Stéphanie Sédou, French ambassador, to join us and to answer our questions. Okay, Stephanie, we know that France actually supports the efforts of those UN agencies in order to have a high-level expert committee. I would like to draw your attention that if we are not wearing masks, that's either because we have been vaccinated or because we have been tested negative. Some people will join us live, others will join us from abroad. As far as we are concerned, we are not wearing masks because we are respecting the measures that are necessary. Stephanie, we heard you last April. You encouraged our approach. There's more and more experts who are questioning what we're doing. But first and foremost, what about those UN agencies that France and Germany and other countries invited to join a high-level expert panel? Okay, thank you very much for your invitation. I'm very happy to take part in the operational launch of this One Sustainable Health Forum. It's a great dynamic. We were together last November in Berlin for a first launch, and that was last October 26, absolutely. That was with the World Health Summit. So, short than a year later, it is the concrete start of this forum. And indeed, what is interesting and important is that everybody is committed, and we have some commitment from the top directors, the top members of those agencies. And France was, with Germany, at the forefront of this initiative. It was launched in France and in Germany with Jean-Yves Le Drian and his German counterpart for the creation of an expert panel to work on the One Health approach. It was set up last May, so 2 months ago, with 26 high-level experts whose mission will be to advise the decision-makers while analyzing the data that is available and making sure that they can be communicated and understood by the general public. Our significant approach is that this effort is joined by the 4 key UN agencies, the 2 we've just listened to, FAO, the World Health Organization, the OMH, and the Environmental Protection Agency. So it's really the highest level, and it brings us to the political sphere and the political decision makers. Okay, so with this expert, there is one French person, Serge Morand. He will join us later. And he's with Professor Antoine Andremont, a key member, and I invite Professor Andremont to join us. With regards to Serge Morand, we have an expert who is convinced of the importance of this approach. Do you think that this COVID pandemic is leading to the realization for the government of the necessity of this approach? Because Antoine, for example, has been convinced for a long time. But is the scientific sphere joining the political one? Obviously, it's a wake-up call. A brutal one, but a wake-up call, because this One Health approach has been carried by France since 2011. There was a statement back then saying that the international health safety was linked to human, animal, environment, education, a wide panel of disciplines that intersect. And that is a global approach. That means solidarity. That means that everybody should have access to those resources. We have a strategy for global health since 2012. We are currently working on this, further to the recent developments. And at the political level, the G7 and G20 levels, the French president is actually carrying this voice, this message to his opposite numbers. So we are contributing to this One Health approach. I would also like to mention a French initiative that is different. It's PRESOD. PRESOD is a network of scientists, and it was launched by 3 research institutes, INRA, CIRAD, and IRD.
peut-être dire un mot pour dire combien on a parlé tout à l'heure du haut panel, d'experts de
talked about the One Health panel, that's Franco-German, and the link between science and politics. And I would like to stress that the One Sustainable Health Forum is the link between science and the field, the labs and the field. So it's important to have those two approaches so that the forum brings together experts, scientists, actors in the field with their diverse skills in order to bring together data, experience, and maybe we will learn from them, and we will be able to carry those lessons onward and to the level of the decision makers. I believe it is interesting to have such a coordination, because there are quite a few initiatives at the moment. They are inspired by the One Health approach. It is important to have a place where all those initiatives can converge to. Absolutely. It is one of the objectives, and Professor Andremont is following this this approach. And those different approaches are actually a reason to wonder what can be done about our health, and to understand that whatever we do actually has an effect on our health, be it urban planning or whatever. And maybe Antoine Andremont can share some information with us. Can you tell us a little bit about environmental pollution and the link with health? Yes, absolutely. With regards to antibiotics, we are learning every day about the impact it can have on the environment. We've all taken antibiotics with a great benefit. But we also know that we use them too much, and we use them when we don't necessarily need them, and that we feed them to animals. And although this medication actually end up leaving our body and end up being in the environment. And we have, unfortunately, great residues of antibiotics in our global environment. So it's a different way to look at things. We used to think that once we've taken medication, well, it's over. Well, no, it's not over. They end up in the environment, in fine. And we have to take into account the impact of, for example, antibiotics on the environment.
Justement, pour régler ces problèmes, nous sommes bien d'accord l'utilité de ce forum, de discussion entre experts et les groupes de travail que l'on va présenter là, très bientôt. C'est que nous devons passer sur une réflexion.
Agree, don't we, that we have to link the research to actions in the field. Absolutely. We should have rules, ways to think globally, but also we have to actually open the trunk and see what's underneath. And sometimes we have to get our hands dirty. not only to preserve environment, but also to preserve the environment, because if we don't preserve the environment, there will be a boomerang effect. So you are convinced that we should be committed to working with those international working groups. You teach medicine. I believe you advocate the constant questioning. Yeah, I used to be, children's specialist, and I used to give them antibiotics, and little by little, my conception evolved, my conception of medicine evolved, and global medicine means that whatever we do must be taken into account if we want to preserve humans' health. And we have to look at our impact on the environment in order to do so.
Madame l'ambassadrice,
Madam Ambassador, at the French Foreign Ministry level, how does it work today? How do you bring all those priorities together? We have here the different logos, the World Health Summit, the Sustainable Health Summit. We are here in Lyon. I believe you will come back to Lyon often. There's the Geneva Health Forum. It's not too far. How do you see and what do you recommend we do before we start working concretely on those working groups? What are your recommendations with regards to the way we should be working together? I don't know if I can actually make recommendations to expert scientists, but what is sure and what we are looking forward to and what we expect now that we have experienced COVID-19, the wake-up call I was referring to, and now that we must be smarter and think more widely, we have to be concrete. So we are installing structures, we have scientists who are fully committed to working with us. But the One Health approach is to link all the participants together, starting on one given case, from one given case. So when we work together with communities, with people in villages, based on their habits, we have with the IRD, the French Research Institute and Development experts, we have people in the field working with locals, not necessarily to create a model, but to give the full value to each of those examples and leave a ultra-mega global approach to a specific one, and if needed, we will draw a lesson from all this. If by the next World Health Summit in Berlin, where experts from all over the world will meet, if we could illustrate further to the work of the different IWGs, illustrate our work, our experience, our different formulas, which may not be a reinvention of the wheel, but a different, a good practice. If we can give a value to this, then it will be a great step forward. And as Antoine Andermont was saying, we will succeed to progress the One Health approach.
Organisations, justement, puisqu'on a une vocation internationale qui nous écoute, qui nous entendent, rejoignez ce forum. Voilà,
so, it is a collaborative forum, so we welcome all organizations. We actually had a press conference this morning here in Lyon with the Pasteur Institute manager, with Vetagro, with IRD directors, with Action Against Hunger, and others. We have the Malaria Training Center in Bangladesh. We have Kamel Mouela from the Lebanon. It's a starting point. And we have to see the different flows and where we can connect and how we can connect. We met in Madagascar a few years ago on such a program in order to fight the resistance of viruses and of local populations. And it was concrete, and it's interesting to look back and to see what worked. It is true that in the field, we try to figure out how things work, and in my case, how the use of antibiotics impacted humans and animals and the environment. The difference with the One Health approach is that we do this all at the same time. Basically, we need a dashboard, we need a control room where we know what's going on. The World Health Organization was extremely proactive in this area and launched a few months ago an indicator that allows us to do that. And I hope that it will be used throughout the world. So it's a first brick of the wall, of the bridge, and this allows us to see the impact of an action. In my case, it stemmed from bacteriology, but it was not enough. We need to integrate with this action, it's what we call hard science, human sciences, ethnology, sociology, in order to understand for each population what those health interventions mean. As Madam Ambassador Sidi was saying, if we do not add to our effort in hard sciences this socio-ethnological, geographical and legal approach, we will not be able to seize the problem and transmit it to the local populations so that they can help us. So it is a holistic approach that we need and that we need to be more efficient. So it's not enough, it's a social, it's an economic approach.
Comme ailleurs, et d'ailleurs c'est le thème du groupe de travail international le numéro 6 qui sera présenté, qui est de
And this is actually the 6th working group, the development of One Health practices and resilience within Indigenous and other local communities. Let me remind you that we are launching the OSH Forum here in Lyon. Between now and when we meet in Berlin in 3 months' time, you will have 3 months to work and with other experts, with no label, with no hat. Those experts will be independent, and in parallel, we will have a panel of organizations, and every week we will we are seeing the interest of different organizations to join us. Just a few words. You mentioned training and education. It is a very important dimension of sharing the results of this forum. You mentioned the creation of the Health Academy of the World Health Organization. It was supported by the President of the French Republic. And it's great to see that the One Sustainable Health Forum is launched in Lyon, because it will create superb synergies with this approach. Thank you, Professor Antoine Andremont. Thank you for coming and sharing your thoughts with us. Let's continue with Madam Ambassador Sedou. We are talking a lot about vaccines. France is part of the ACTA program. What is the situation today with regards to sharing access to vaccines? And I'll take the opportunity of this break to ask Edwige Coupé to join me here. She will be presenting the different international working groups. So back to my questions about the shared access to vaccines. France is one of the first partner of the World Fund. What is the situation today? Well, the World Fund is committed to ACTA, so it's Access to COVID Tool Accelerator. It's a great initiative that the international community took, and France took part from the beginning of the COVID crisis. The objective is to allow access to vaccine to different populations around the world. Today, we are fully committed, and we have seen the efficiency of donors. France gave a huge number of doses that can be found in about 20 countries. We will be sharing more and more. And it took a little bit of time at the beginning, but soon enough it will speed up. And the objective for France is that 60 million doses be delivered by the end of the year. Furthermore, another effort is being made to increase the capacity of production in the countries that produce, but also in other places in the world. It is a difficult situation at the moment. It's difficult to produce, but the forecast is good. We need to be strong for another few weeks. France has asked other countries to come and join us to share the extra doses they may have with countries that do not have access to vaccine. Thank you for coming. Thank you for sharing this information with us. And thank you, Edwige Coupé, for joining us and launching those groups. Thank you, Benoît Miribel and Stéphanie Sedou, for this great introduction. Stephanie, you're the French ambassador for World Health. So let's actually launch those sustainable, those international working groups. And number one, how to mitigate the impact of environmental pollution, climate change, and pressure on biodiversity to reduce diseases. This is group number one.
Et nous accueillons pour ce premier groupe de travail notre première invitée.
And our first guest is Antoine Andremont. Please join me.
Antoine Andremont, qui est professeur de
Antoine is a professor of microbiology at the University of Paris, and he is going to tell us more about this first theme, one of the 6 themes that were chosen.
Un petit délai avec Antoine Andremont et nous allons plutôt entendre Patrice Debré, qui est le directeur international de l'Académie.
We have a slight delay, so let's switch to Patrice Debré.
Bonjour.
Bonjour Pascal Debré. Patrice.
Bonjour à tous. Bonjour à toutes et à tous. Donc,
hello, good afternoon, everyone.
Qu'on pourrait appeler lutter contre les menaces du dehors.
Actually, we could call this group how to fight against outside threats, how to reduce the impact of pollution and the reduction of biodiversity and health. And this group should think in 3 different ways: analyze, understand, and suggest. How to analyze things? There are 2 threats, 2 types of threats: physical and chemical and microbiological. Indeed, we need to measure the modification of the environment generated by the chemical pollution, like lead, benzene, or physical, like radiations, or for all those, analyze the different causes linked to demography. We went from 1 to 7 billion people in 200 years. It can be linked to rapid urban growth, and this can lead to modification on health, be they hormone-based or cancer. There's another series of causes. It's linked to microbes. It's the emergence of infectious diseases linked to all modifications, and the fact that man and animals are closely living together, and it is also linked to the different flows of man. There is another cause on health, and it is the development of certain pathology like obesity and cancer, but also autism and autoimmune modifications. And between the environment and the microbes, there is what Antoine Andremont was telling us, which is the resistance anti-microbial. So we will need to analyze those causes and reach operational prevention measures to fight against pollution of water and fight the use of toxic products, whether they come from medicine or agriculture, the overuse of antibiotics, atmospheric pollution, or how to fight climate change and its impact on vectors. And the different ways to fight insects. Thirdly, we'll need to understand, and we'll have to realize how those different developments have an impact on man. It takes a series of expertise in different areas, in biology, environmental, medical, and human sciences and social sciences. So at the end of our analysis, we'll make concrete suggestions. Thank you, Patrice Debré. It's a vast program that you have just detailed, analyzing, preventing, and understanding the different threats. And in order to reach this level level, we will need several experts, and there are quite a few working on this working group. There is Irina Rybarova. Hello.
Vous êtes à la tête du département de génie hydraulique à l'université de Sofia.
You are the head of the hydraulic engineering at the University of Sofia. Would you care to explain to us how you will intervene within your group?
Yes, thank you very much. I would like to pay attention to some challenges associated with the introduction of the circular economy in urban water management. Our society has reached a level of maturity which enables understanding that cradle-to-cradle economic model provides many more opportunities for sustainable development than the current cradle-to-grave economic model. In particular, related to urban water management, it appears that there is consensus that wastewater should no longer be seen as wastewater, but as reusable water, rich in resources, ready to be fed back into the economy. However, there are a number of challenges associated with this otherwise novel concept, like do we have sufficient knowledge to transform the existing huge and expensive urban water systems into circular ones? Do we have sufficient knowledge on the functioning of the new circular systems? Do we have sufficient knowledge on how the reused wastewater impacts human or environmental health? Do we have sufficient knowledge to detect and control pollutants, to understand pollution pathways, or to identify the associated risks, and many others? Given the complexity of these challenges, possible ways to overcome them appears to be that, first, bringing science to new levels, to invent radically new technologies so that to make a technology breakthrough. And second, bringing education to new levels to ensure pollution prevention through responsible behavior of both consumers and producers. I myself will contribute to these issues and challenges. Thank you.
Thank you. Merci, Irina Rybarova, à la tête du...
Thank you, Irina Rybarova, at the university, from the University of Sofia.
En duplex avec Sylviane Rath. Bonjour,
I will now invite Sylviane Rath. Hello, everyone. You're the European manager of Vital Strategy. What do you have to say about this this level of expertise? Real quick, Vital Strategy is a public health organization, and we are working with a variety of problems around the world, especially with countries with limited income. We help local and national governments. We have experts, and their objective is to reduce air pollution. We know that when we reduce air pollution through the reduction of nocive emissions, it has an impact on ecosystems and climate. It is really where we concentrate on, and we like to analyze the different impacts of our actions. Vital Strategies is working through different angles. We have established a partnership with OHS, UNICEF, and others, and our teams are expert in epidemiology, in public health, in communication and communication strategies, and all this is extremely important in order to communicate at the decision makers level as well as the political or general public level in order to know what can be done. Within this working group, our experience and our expertise will be paramount. I would like to underline the fact that Vital Strategies is committed with the coalition of foundations defending climate, and I would like to praise the work of CFF in order to bring all the donors together so that foundations in France and Europe take the climate change fight, or the fight against climate change, seriously and embrace our cause and invest in products that are good for the general interest and good for the climate and health. Also, when they finance projects based on proofs and proven solutions, it is also great. We have a multidisciplinary approach. It's our daily approach. It is our way to work on the reduction of air pollution. We work with urban planners, engineers, with the different town councils. I would like to ask everyone to get to work. There's an awful lot of work needed. And I think that the One Health approach is absolutely fantastic. We were all looking forward to this, and we are thrilled that it has now been launched. Thank you, Sylviane Ratt, European Manager for Vital Strategy. Thank you for sharing this information for the first working group. Let's move to working group number 2.
Le groupe de travail numéro 2 qui
Working group number 2 towards sustainable food and nutrition. It's a great topic, and my first 2 guests are Babette Simon
et Martin-Yves Pradel. Bonjour.
And Yves Martin-Prével.
Je vous laisse vous installer.
Merci.
Merci.
Alors, Babette Simon, vous êtes professeur
Babette Simon, you're associate professor at the Health School of the University of Paris. If you are manager at the Research and Development Institute.
Je vais vous donner en premier la parole, Babette, et puis ensuite Martin-Yves Pradel, pour nous présenter un petit peu les enjeux.
Okay, Babette, first of all, what is at stake and how will you work?
D'accord. The health of our planet has sharply declined the last decades. And this is due to loss of biodiversity, climate change, and pollution. And this is a major threat for our health. And a major factor or a major driver of this changes is the food and nutrition sector. So, and that's why we choose that topic for the International Working Group 2, where we look at the food system, better nutrition, food waste management, and where we also focus on the impact the food system has on the environment. For example, agriculture, what is the agriculture doing to the environment? And the third group will look for the impact we have on humans, for example, antimicrobial resistance or the chemicals which we sometimes, unfortunately, eat. And the fourth theme will deal with fair commercial and financing. So, and the major challenges we are facing in the future is, first of all, we have no time. the food system is one of the major reasons why we are already living outside our planetary boundaries. So, and just to make that clear, so the food sector is reducing biodiversity and is responsible for 1/4 of all man-made greenhouse gas emissions. And the second very, very important challenge is the growing population. We are going to have, that is projected to increase about 60% the population until 2050, and we have to feed them. And that might go along with also changes in our way we are in the food system, hopefully. And the third big challenge is malnutrition. And we have 1.9 billion people which are overweight. And we do have also about 40 million which are underweight. But today it is unfortunately so that many more people consume low diet, low quality food. So that means high fat, high sugar, and a lot of salt, so energy dense food and highly processed. And that leads then to obesity or diseases like diabetes, coronary heart disease, stroke, and so on. I think these are the major challenges we have to face. And so you see, it's a very complex topic, and we are going to address that in a multifaceted way, in a systemic approach. And we are all part of the food system, so we have to find all together a way to solve that problem, to find new ways, and to find also or define concrete actions to transform our world's food system. Just in a small roundup, it's much more complex.
Yes,
but just to get an idea what we are planning to do there.
C'est un vaste programme que vous venez d'exposer. Merci.
It's a great program. Thank you very much, Babette Samon, Associate Professor at the Paris Health Faculty. How to feed the world population without impacting the environment, how to avoid malnutrition, and how to avoid illnesses linked to malnutrition like diabetes. Yves Martin-Prével from IRD. How will you seize all those topics? Well, we have a lot of work, and as a research institute, our role is to accompany, to help people understand what we need to understand is that the system is not working. Sometimes we have illnesses because of too much of something or because of not too much of the same thing. That means that there is something that is not working, and this is why a third of the people in the world is not eating properly. That is the proof that we cannot go on thinking in the same way. It's not a matter of production. It's not techniques and innovation that will lead us to producing more. Well, no, we have to respect the limit of the planet, and we have to think differently, and this is why it is difficult. If we want to have one health, it's not changing the paradigm. It's just changing the way it's just changing the system. There is a world system, there is a local system, and okay, if it's local, it's better, it has less of an impact. Well, it's not necessarily the case. We need indicators, and we need to understand the impact of those food systems on the planet, And at the same time, we need to understand its impact on both people and the environment at all levels. Systems can be totally different, but they have one thing in common, is that at the heart of their working, there are people that will be more powerful than others, and who will be able to impose their point of view. So if we understand better how it works, it it will be easier to understand how the systems work, how to dialogue with everyone, and to bring answers that are acceptable to all actors. We're all on the same boat. If we don't want the boat to sink, we have to row together. Okay, we don't have much choice. We have to seize that topic. Thank you very much, Yves Martin Prével. I have a video to show you from Action Against Hunger. In northern Cameroon, we have launched an agricultural training program to transmit a practical agroecological approach and avoid the use of pesticides. My name is Mohamedou Isma. I'm a group moderator, which means I'm the link between Action Against Hunger and my group. I am trained, and then I train the folks in my group. We grow sorgho, mainly, peanuts, enyebe, and corn. We have learned several techniques, for instance, compost preparation. The group also prepares biopesticides with grains to fight against devastating bugs. More than 4.9 million people face food insecurity in Cameroon. With this program, we are bringing a sustainable solution to farmers. This agricultural training program is an opportunity to share ideas and experience. We first paid dues, and then our crops fed us, and when we produced more than we needed, we were able to sell. The program has trained more than 700 participants, and in parallel, we lead activities to improve early tracking of malnutrition. Action Against Hunger is more than feeding.
D'action contre la faim. Pascal Revaux, vous êtes le
Pascal Revaux, you're the expert director for Action Against Hunger.
Les enjeux qu'il y a face à la malnutrition.
We saw in this report what is at stake with regards to malnutrition. Concretely, what will you do in your working group? Well, first of all, we help children suffering from acute malnutrition. It's difficult. There are 15 million children who risk dying in the world. 47 million suffer from acute malnutrition, and 144 million are late in their growth and their psycho-motor development and social development. So first of all, we need a treatment that is adapted. And secondly, we need to reinforce the health systems and not treat the malnutrition challenge in an isolated way. There is probably a state of malnutrition that is not dealt with today, is the stunting. It's a great challenge, and we need to work with researchers. We have also to work with regards to the development of surveillance and to understand the waterbeds, to understand the trees, and to see how this impacts health in general. As you saw in the movie, we are trying to work with the transformation of agro-food systems in order, through advocacy, to suggest a change in our food system. We have indeed 10 years before we can cross those 9 fences as defined by Johanna Nordström. And when we change the food system, we can actually start pushing against, leaning against those 9 barriers. We have to work with ecosystems, not against ecosystems. Thank you, Pascal Revaud. You're the Advocacy and Expert Director of Action Against Hunger. We have to be efficient in the next 10 years. We have to find a system that is working with ecosystems. Mamane Zelani, you are the Technical Director of Nutriset. Please tell us more about Nutriset and how it is helping in the field. Nutriset is a company in Normandy, near Rouen. It is a group. We have partners in different countries around the world. 15 years ago, we invented a product called Plumpy Nut. It helps children suffering from malnutrition, and now we have government programs that are using this product. My team and I have found solutions to prevent malnutrition. It is important to have a proper nutrition in order to be healthy, to grow in a healthy way, and to learn efficiently at school. I'll show you a video, but globally we are transferring our technology, our skills, our know-how to our partners where there is high malnutrition and where they need us. So we are partners to develop new initiatives. The reason we joined one Sustainable Health Program, Forum, and this is where I agree with Pascal, is that in order to go from a clinically validated project, we do not necessarily find the appropriate program. So we need, I believe, such a platform to have researchers, to have public and private partners, to generate a momentum and to approach health globally. Thank you, Mamane Zelani. You are talking about a report. Well, this is it. When Michel Lescan founded Nutriset in 1986, his objective was to feed children. Today, that objective has become a mandate to fight undernourishment in the world. Such a fight means having the best nutritional solutions to meet a given challenge, be it at the world or local level. It also means having an impact on the economic development of the countries we are trying to help. It is why we developed the Plumpy Feed network. We are not a multinational set up in every country, but a local partnership able to bring a nutritional solution accompanying local authorities to meet closely the needs of children and their mothers. It gives us the opportunity to take part in the development of local agriculture to reduce our environmental impact and increase our economic and development impact. Nutriset deals with malnutrition in the world through strong partnerships with the UN, UNICEF, WFP, and NGOs like ACF or MSF, or with local governments. But it also deals with the older people, the malnutrition of older people, or of people with specific illnesses. We believe this initiative will help us defend our convictions. Nutrition is not a branch between agriculture and health. It must be part of a health system. Nutriset is proud to be a member of this initiative.
Merci beaucoup.
Thank you very much, gentlemen, for this working group number 2.
Au sein de Nutriset et au sein d'Action contre la faim. Donc Pascal Revaux, expertise et plaidoyer d'Action contre la faim, et Maman Zelani, externe chez Nutriset. Et vous allez donc travailler, je rappelle les noms de nos précédents invités, qui sont aussi au sein du groupe numéro 2,
Babette Simon et Yves Martin Prével.
Autour de cette alimentation et cette nutrition durable. Merci beaucoup. Nous allons maintenant passer.
Thank you very much. And let's go on with working group number 3.
Voilà pour ce groupe de travail numéro 3. Alors le thème de ce groupe
The theme of this third working group is how to adapt human environment paradigm for a better human and planetary health, the key concept of One Health, and that working group is presented by Nathalie Gerson. She's Deputy Director of Vet AgroSup. Welcome, and thank you for coming. And we have Benjamin Roach, who is Research Director at IRD.
Bonjour Benjamin.
Hi Benjamin.
Est-ce que vous pouvez, Benjamin Roche, nous présenter ce groupe
Benjamin Roach, could you present that group and the stakes it is facing? I am thrilled to take part in that working group. We will deal with the different aspects of human and animal health and infectious diseases. COVID-19 taught us that we couldn't just wait for a microbe to come before starting to try to limit this problem. We have to detect them upstream in order to be able to answer quickly. And we have to develop strategies that integrate the management of ecosystems in order to modulate reduce the level of transmission of those zoonoses. It is at the heart of our work, like PRESOT, that was mentioned, and it is also mentioned in the high-level expert panel. Those zoonoses usually appear in the tropical zone or with countries with lesser income. In order to answer that complex question, this One Sustainable Health approach is very important because it helps local populations within a global and sustainable approach. And with these different perspectives, it will be the leading way to think within this group. Thank you, Benjamin Roche, Research Director at IRD. And I would like to connect with Francine Ntoumi. Francine, can you hear us? Maybe, Francine, you need to switch on your mic. Microphone. You are the CEO for the Congolese Research Center. You will be a member of that third group. We can hear you. Perfect. Thank you very much. What will be your role within this group? In Congo-Brazzaville, where I manage the Congolese Foundation for Medical Research, we have been working on malaria, chikungunya, and other infectious diseases. And as Benjamin said earlier, in Congo, we are in Central Africa, so we're not too far from the rainforest, and with the diversity of the fauna and the flora that has not been explored yet, we realized that those changes had an impact on the different illnesses. So what we did was to change our way of working and leaning on multidisciplinary skills in animal health, human health, and the environment. And it's true that, for example, with malaria, obviously the environment is a great place for mosquitoes to thrive, and then they infect humans. Secondly, we need strong partnerships, long-term partnerships, locally, nationally, and internationally. Since 2018, I managed the One Health Pandora network, and that network is available, is an open network, and is available for everyone. There are 24 partners, academic, research, different disciplines, 13 countries, 3 continents, in order to meet the different challenges that we face, that we are facing today, and that we will no doubt face in the future. This is what we will try to bring to that third working group. Thank you, Francine. Thank you for this presentation. Our next guest in Duplex is Serge Morand.
Bonjour.
You're a researcher at CNRS and CIRAD. You're a member of One Health high-level expert planet. What is it exactly? It is actually further to COVID-19. Several initiatives were launched at the world level, and this is one of them. It's also with the neglected tropical diseases. The One Planet Summit in 2021 saw the launch of PRESOD. So it's one of those actions that we see. In June 2021, the World Health Organization, the FAO, and the UN Programme for the Environment jointly launched that One Health high-level expert program with 26 experts are coming from different countries in the world. It's people with different profiles. It's like a forum, even though they are usually health experts, human, animal, and environment. But our task is to analyze, from a scientific standpoint, the emergence of sanitary crisis, the result of the link between man, animals, and the environment, and maybe come up with a strategic answer in order to reduce risks of such crisis, but also to foster synergies. Globally, it's very close to what the forum is doing. And within those interdisciplinary questions, we will be able to coordinate and answer accordingly. I believe it is important to note that we have 4 working groups only. One group that will work on the implementation of One Health. We will have a group working on the current knowledge, the best practices with examples. The third group centered on surveillance and early detection and quick sharing of data. And the fourth group focusing on the factors that can explain the spillovers of new infectious diseases and their propagation. So it will be a list of the situation, it will be a list of data, of knowledge, and so the different groups will be able to work together with the One Sustainable Health. But this One Sustainable Health Forum will be a facilitator between the different participants, and it will reinforce the necessary synergies for a better dialogue between political decision makers and scientists. Our challenge is to go beyond the silo thought, to develop a systemic thought, to be better informed, to be more flexible. It will mean that we need to explore knowledge and access knowledge outside of local processes. We have to be interconnected. We have to really have a multidisciplinary thinking in order to deal with a sustainable health issue. Thank you, Serge Morin, researcher at CNRS and member of the third panel. Nathalie Garçon, you work with Serge Morin on this panel. You are deputy manager at VET AgroSup here in Lyon. How do you work with Serge Morin to reduce the impact of the environment?
Alors, en tant que directrice générale adjointe, mais aussi
as deputy director, but also as manager of France Veterinarian Services International, I have to say that veterinarian studies have always been paramount to our approach. And our sector has always been between the environment and man, and we have always worked with the safety of food and safety of animals. It is true that biodiversity has seemed to be not extremely developed. So we decided to take into consideration different principles and the phyto and antibiotics, and we decided to join the One Health approach with a degree that Serge Morin actually launched in 2020. It was prior to the COVID crisis. It was the 12th of March 2020, when COVID-19 became officially a world pandemic. The idea is to train veterinarians, doctors, ecology specialists, representatives of social sciences, but also economists, legal specialists, to those problems in order to find a global solution. Last March, there was an interdisciplinary seminar with 5 associations of environmental protection, and we made concrete recommendations through 7 workshops, one of them being on the organization
souvent l'environnement est assez éclaté entre plusieurs disciplines, et c'est justement cette
local environment, and it revealed this efficiency when we work in a multidisciplinary way. We carried on this work within the school, with the graduate school, with public officials. We are trying to explain to the future civil servants, and we are developing a master's managing health in population in order to integrate this teaching and this research and the management of risks. And this will actually reveal the different links with OSH. It is true that our objective is to transform all those tries and with all the different organizations that support this One Health approach. We have the academy that will be launched in 2023 here in Lyon. So Lyon will be the center of global health. So it's important not to miss a link in the chain. It's human, animal, and environmental health. It is important to train indeed. Nathalie Garçon, Deputy Manager of VET AgroSup. We are now turning to Flo. And you are joining us from Venezuela, and you will also work with this third group.
Merci beaucoup à la Fondation Une Santé Durable pour
Flo
tous.
Pujol from the Venezuelan Institute of Scientific Studies. We are joining this group because for the last 5 years, Venezuela has been through a deep crisis leading to immigration of 4.9 million people, the second largest after Syria. And we have teachers and students who migrated as well. The average salary is $20. And therefore, we have an intellectual diaspora that is almost 10% of the population. So I am in charge of viral hepatitis and AIDS. I manage the reference institute here in Venezuela, and we have decided to commit to the diagnostic and the molecular surveillance of diseases. COVID here in Venezuela was officially very low, but in fact, the diagnostic was not sufficient. The modelization studies and the dynamic of pandemic that were made by epidemiologists were key to understand carefully the importance of the pandemic. It revealed the importance of interdisciplinary studies when we are talking globally about One Health. Thank you, Flo Pujol. And that was the conclusion of the third group, how to adapt the human environment paradigm for a better human and planetary health. Benjamin Roche, Francine Ntoumi, Flo Pujol, and Nathalie Gerson. Thank you to all of you. Let's move on to working group number 4, equitable access to quality healthcare.
Et pour ce groupe de travail numéro 4, j'ai l'honneur d'accueillir sur ce plateau
I am happy to welcome Runa Khan.
Welcome. Je vous laisse vous installer. Merci beaucoup. Vous êtes fondatrice et directrice exécutive
Runa Khan, you
managed
and you founded and manage Friendship NGO in Bangladesh. I will be back with you in a second, but we have other guests like David Eman, who is a doctor, epidemiologist, professor at the London School of Hygiene and Tropical Medicine. Hi, David. David Heyman.
Vous m'entendez? Bonjour David. Vous allez souligner pour nous l'importance.
You will underline the importance of world access to healthcare.
Thanks very much. Yes, I'm very happy to talk about equitable access to healthcare because nothing has demonstrated the need for this more than the West African outbreaks of Ebola in 2013 and 2014. This was an outbreak caused by an emergence of the Ebola virus from the animal kingdom to humans that first caused a localized outbreak of Ebola. That outbreak was then amplified in healthcare settings by failed infection control measures. They resulted in spread of the virus to patients being managed in the healthcare facilities for other conditions and to health workers themselves, who then inadvertently infected their family members and others in their communities. And when health workers became sick, they were not able to obtain health care that could have saved their lives, nor could their families and neighbors, because their health facilities could not cope. Contrast this with the health workers of the international teams who supported the West African countries in containing the Ebola outbreak. If they became infected, they were rapidly transferred to hospitals in their home countries, and most of them survived. Inequalities in access to safe and effective healthcare could not be more clearly demonstrated, and they must be rectified. But the scenario in West Africa is not the only example. The Middle East Respiratory Syndrome virus, MERS coronavirus, periodically emerges from camels to humans. It rarely spreads from human to human. Yet, in South Korea, when one infected person who traveled from the Middle East entered a hospital with unsafe infection control, over 200 persons became infected and over 30 died. And when health workers became infected with SARS coronavirus in 2003, they inadvertently amplified transmission and spread the disease to countries around the world. I think you'll agree that an important challenge for those who work in the area of one's sustainable health is how to decrease the risk of emergence at the animal-human interface and how to ensure equitable access to safe healthcare for all. But there's another very important area concerning equitable access to safe healthcare in animal and human health, and we heard about it earlier from Professor Andermont and others: antimicrobial resistance. Resistance of common disease-causing bacteria in humans, animals, and the environment occurs because of our own behavior in demanding antibiotics from healthcare providers, the behavior of doctors who use and overuse antibiotics in treating humans, the behavior of veterinarians who provide antibiotics to help compensate for infections caused by careless animal raising practices, and the behavior of farmers who spray their fruit and vegetables with antibiotics to prevent blight. Examine groundwater or sewage in any country, and you will likely find antibiotic-resistant bacteria that eventually make their way to humans, animals, fruits, and vegetables. Today, the challenge is SARS coronavirus 2 and COVID. Tomorrow, it will be other unknown infectious diseases, but the problem of antimicrobial resistance will continue, and it needs innovative solutions to preventing infections in hospitals and in humans, animals, and the environment. I believe you will agree with me that Working Group 4 has many challenges to address to ensure equitable access to safe healthcare. Thank you.
Merci beaucoup, David Heyman, et nous sommes effectivement d'accord avec vous pour.
Thank you very much, David Heyman. Indeed, there are several challenges, and that will be the hard work of group number 4. We are now with Willem Cantin. You manage the Global Health Center at the University of Berlin, and you are a member of that group number 4. What do you have to say about equitable access to quality healthcare?
Yes, thank you very much for the invitation. As a researcher, I've worked a lot for the European Observatory on Health Systems and Policies, which basically aims to support evidence-informed policymaking to strengthen health systems in Europe. And the aim of strengthening health systems is usually to assure equitable access to quality healthcare, apart from making health systems more efficient and more cost-effective. And this work almost always involves research that will support strengthening health systems in Europe, but then also to talk with policymakers to make sure that this research reaches the ears and eyes of policymakers. And at the same time, my ambition as a researcher is to also contribute to strengthening health systems in African countries. And I've led several projects that aim to strengthen capacity in health systems and research and management in Ghana and in West Africa more generally. Now, the goals of the International Working Group number 5 are very much aligned not only with my own ambitions as a researcher, but also with international efforts to achieve universal health coverage, which is target 3.8 of the Sustainable Development Goals. And achieving universal health coverage means that all people should have access to high quality care without being exposed to financial hardship. And these are the two aspects of universal health coverage. And because this is the case, the aims of International Working Group 4 are very much aligned with international aims to achieve universal health coverage. And to achieve universal health coverage, it is necessary to think more broadly at the system level about how health systems can be strengthened. And in many countries of the world, achieving universal health coverage will require increasing public funding in order to expand public coverage schemes and to make sure that everybody has access to care. And this means that on the one hand, health insurance needs to be extended to the uninsured, that all relevant essential services need to be included in public benefits packages, and that also countries need to get rid of excessive user charges that prohibit equitable access to care, even for things that are in theory covered by public healthcare systems. And in addition, in order to improve quality of care, because it's not enough to only assure access to care, it is important to strengthen those quality governance systems, to expand human resource capacities, to assure availability of technologies and infrastructure, and to explore the potential of digital technologies in contributing to improving quality, but also in the potential of digital technologies that can strengthen public coverage schemes by supporting public financing for healthcare. So in general, in conclusion, without strong health systems that are designed in line with principles of solidarity, it will be impossible to assure equitable access to high quality care. And I believe that International Working Group number 4 needs to study these aspects of how to improve coverage and how to make progress towards achieving UHC in order to assure that we will achieve equitable access to quality care for all.
Merci beaucoup, Willem Quentin, chef du département de santé.
Thank you, Willem Quentin, head of the Global Health Department at the University of Berlin.
Serge Bress, bonjour.
Serge Bress is our next expert. You are the Director General for Soltis NGO. What is Soltis?
Bonjour, merci. D'abord, je voulais remercier les organisateurs.
Thank you to all the organizers for the invitation. Thank you, Benoit. Soltis is an NGO in West Africa over the last 20 years over AIDS challenges and infectious challenges and sexual health as well. It is an important group. We are aiming at everyone having access to quality healthcare. We have a concrete vision. We are in the field, and we believe it is important for everyone to have our return of experience. We are committed to working on this project because we know the fragile, isolated populations suffer from bad practices and climate change. It is important to prevent, and we must all work, and this is why it is important to recognize the role of civil society at the community level. And you will see in a video that you will watch later in the program that we have developed with our partners. We are developing a modern approach. And we are aiming at working with all health actors. The current crises are multifaceted, and consequently, we also want to work on efficient responses to how to aid countries and reinforcing the work of national actors. Obviously, all this must be people-centered, and that will be all for me, and I yield the floor to Runa. Thank you, that's a great transition. Thank you, Serge, Managing Director for Soltis. Okay, we have seen several initiatives in order to facilitate access to quality healthcare, especially in Africa. I would like to take you with me to Bangladesh with you, Runa Khan. Your video will present your NGO, Friendship in Bangladesh. How will you work within that fourth group with the different experts we have already heard?
So, Friendship, we have been working with an integrated system, which is one sustainable solution really for 20 years. And, we have learned, from this shared human crisis now that human health is interlinked to all life, man, environment, animals, impacting dignified survival for all on this planet. And we all have a right to this planet, and humans, the most prominent force, need to accept this respectfully. OHS is a collaborative platform for verbalizing this already proven approach scientifically, and for better acceptability and understanding of the actors who are working on this, scientists to decision makers, who are all striving, needing to understand its importance and to do this sustainably. It's very important. And for us, the term sustainable gives rise to a whole range of interpretation, from finance to continuity. But in reality, it refers to the integration of action to care for human, animals, environment in an equitable balance and on this planet. And this will ensure health and dignified survival for all living beings. And we need to continue the interlink of all needed elements for this survival and this sustainability, all that we see around us, so that health is not an element, which is addressed dramatically when a crisis arises or in isolation. But healthy life becomes an outcome of a way of life, of living, of hope, of dignity. And this is, I think, the strive of one sustainable health. And I think when Benoit started this and we kind of all were on the platform for starting this work, it was what I have been striving for 20 years. So for me, it was really like a dream that we could bring this platform to the world, and the world would note the importance that health doesn't, is not acceptable only as health. But in a platform for the whole ecosystem.
Merci pour ce message d'espoir, de dignité.
Thank you for this message of hope, of dignity, and for us to realize your commitment over the last 20 years. I would like all of you to watch a report on your NGO Friendship in Bangladesh.
ces très beaux sourires d'enfants que l'on voit dans ce
Beautiful children smile.
Merci beaucoup, Runa.
Thank you very much, Runa.
Comment est-ce qu'on peut mobiliser, vous
How
avez dit cette
can
urgence de
you
mobiliser à
bring
l'échelle
people together?
internationale
How
et quelque
can
part
you
de ne
have
plus être
people
seulement dans des projets, on peut aussi,
committed
soit-il,
to
donner cet élan?
to this project?
I think one needs a very strong vision. And in this journey of this vision, you can never work in isolation. You only work and you only deliver and you only achieve when your vision can become the vision of all those, who are working with you. Not only of the people working in the organization, I have about 3,000-4,000 people in the organization, but also the beneficiaries and also the stakeholders, and most important, this global team that we have in Friendship International, Friendship France, Luxembourg, Belgium, UK, and Holland. And we are all together. We are a global team. It's not North and South. And I think spreading this has been, I think that the result has been because this has been done with verity. It has not been done just because I spoke about it, but the work, it was shown, and it is only by seeing you understand reality, and verity is a very important word for that. It's not only truth of the work, but truth of the way of work. When I say that we work with values, it means that all our decisions are based on the values. They are not our limiting factor. They're the very essence on which we work and how we plan. And I think this is what has brought the global team together.
Merci. Cet appel est lancé pour donc une vision globale.
Global vision. We are all together. Thank you, Runa, founder and director of Friendship.
De ce groupe, de cette présentation, parce que ce n'est
This
que le début du travail de ce groupe.
End of the presentation of group number 4.
Comment rendre équitable l'accès à des soins
Its theme being how to generate an equitable access to quality healthcare. The different experts that we have met is David Hammond, William Cantin, Serge Bress, and Runa Khan. Thank you to all of them. Let's move on to group number 5.
Groupe de travail numéro 5, donc, et quel en est le thème? Je ne vous l'ai pas encore donné, le voici cette fois-ci.
Global levels of change to foster one sustainable health. That is the theme for the 5th group.
Santé durable pour tous. J'accueille en studio.
I am proud to welcome Eric Comte.
Bienvenue sur ce plateau. Je vous laisse vous installer.
Merci de me recevoir.
Thank you for your invitation.
Le directeur du
You're the
Geneva Health
manager of the Geneva Health
Nous
Forum.
allons revenir vers vous. Avant, nous allons parler avec Andrea
But
Winkler.
before asking you a few questions, I have some questions for Andrea Winkler.
Vous êtes co-chair de la commission
You
de la
are
revue,
co-chair
fameuse
of
revue de
the
Lancet
Lancet Journal.
Comment est-ce que vous allez
How
travailler
will
en
you
collaboration
work
avec ce groupe
in
de
collaboration
travail
with
et
the other
la
members
Lancet
of
One
this
Health Commission? Comment est-ce que
working
vous allez
group?
travailler
What
dans
will be
cette
your approach?
Well, thank you very much for the invitation to this launch. And just a small edit, I'm the co-chair of the Lancet One Health Commission, which is actually a high-level scientific commission that is mandated by the science journal, The Lancet. And I think I very much represent what we have worked on within this commission for the last 2.5 years, and I'm happy to present some of our thoughts here today. Also very happy to see some of our commissioners in other working groups and in this working group. So I can put it actually in very simple terms. One Health must become the new norm at local, at regional, but foremost at global levels. And that includes the whole of society. So we need a whole of society approach in all sectors, including politics, public and private sectors, business, academia, science, education and vocational training, and of course, civil society at large. It must spread from grassroots to the decision makers. And to achieve all of this, we need good governance skills. I think this is really essential. And diplomatic maneuvering in the One Health space so that the different stakeholders are happy to sit at the same table and feel welcomed. We need to make them understand the added value that One Health holds for all of us, and which is not only monetary. We can talk about this later, of course. And we need to make bold proposals on how best to implement One Health for our joint future. So should we rethink the economy, for example, and put One Health at the center? Maybe be quite daring and say, well, argue for a One Health degrowth in exchange for One Health profits. Sorry, to argue for an economic degrowth in exchange for One Health profits. And for our big plans for the future, be it the post-2030 agenda or the international health regulations, a pandemic treaty. So we as the One Health Society need to demand that One Health is actually firmly woven into all these global agendas, not just on the sidelines, but as an integral part. And last but not least, we have big plans, and these plans, they need to be very timely. So let's integrate technological innovation throughout. But at the same time, let's not forget the most vulnerable populations and keep One Health equity as our mantra deep in our hearts throughout our processes. Thank you very much.
Winkler, co-chair de la commission de la revue Lancet sur le One
Andrea
Health,
Winkler,
qui doit devenir la nouvelle norme.
thank you very much. One Health should be the new norm. Okay, Eric Comte.
Comment est-ce que vous comptez mobiliser
How do you intend to bring local communities together?
Pour aller vers cette santé durable pour tous. Comment est-ce que vous pouvez imaginer votre rôle?
How do you imagine your role within the Geneva Health Forum?
C'est sûr que la situation du Covid qu'on a vécu ces derniers temps a mis en évidence la fragilité de nos systèmes de santé.
It's obvious that COVID-19 revealed how fragile our health systems were, and our developing models were just not sustainable. The environmental failures are more and more and cannot be sustained. So we'll need to work on a new model. It will not be with a snap of the fingers. We'll need to find pillars in order to find dynamic actions in favor of a sustainable health. We have found so far 6 pillars. First of all is the empowerment of local communities, how to involve local communities, how to make sure that we can talk with them and they can act for their own change. Nothing will be done without the local communities. Secondly, we need to tear down walls. The WHO needs to work closely with FAO, with CNUD, with OIE and other UN organizations. And health ministries around the world must work with environment and agriculture. We need to promote open science. We need to work in a multidisciplinary approach as well. Thirdly, we need to train people. We need to integrate new challenges in and new knowledge in the training of the next generation. Fourthly, financing. Taxing, investment are important factors that we need to change in order for attitudes to change. Fifthly, digital. New communication technologies exist, new data collection and modelization exist, and they must be used to have a better follow-through of our action. And lastly, we need to have everybody on board. We have bad habits, and it's difficult to change a bad habit, and the decision makers will not do much if the population is not here to request those changes. So those are 6 points that I would like to present to the group, and I'm sure there will be others. I believe that the networks we are developing will help us to dig deeper and set up concrete actions. Thank you, Eric Comte. Indeed, you advocate bringing together the different communities and working around those 6 themes. Our next guest is Ole Peter Ottersen. You're in duplex from Sweden. How will your institute work concretely, the Karolinska Institute, to participate in this 5th group?
Yeah, first of all, I'm very happy that I'm now part of this working group and this excellent network and initiative. This is really what we need given the challenges ahead. So first, I have 3 different points that I think are relevant to the discussion at hand. And these 3 points are coupled together, certainly. Yes, we need to work across communities, as was just said. But the first point is we need to work across sectors, obviously. We have to reach beyond the healthcare sector to really tackle the challenges that we're facing now. Health is cross-sectoral or multi-sectorial. And we have to realize this in the work ahead. The second point is coupled to the first one, and that is that if we realize what is the case, that health is multi-sectorial, stretching across political sectors, then of course we have to look at the political determinants for health. That must be a very important part of our work. I was chairing a Lancet commission on this very issue, the political determinants of health, 3-4 years ago. And the results and conclusions of this Lancet commission are still valid and even more relevant today than they were 3-4 years ago. The political determinants of health are essential in order to know how we can implement new data, how we can ensure that our knowledge is translated into new policies for a better health. The third point is coupled, as I said, to the 2 first points. We have just established, in order to be synergistic to this initiative, we have just established at Karolinska Institute a science center for health emergency and pandemic preparedness, a health emergency and pandemic preparedness science center. And this is based on the One Health concept, that we have to see to it that we join the challenges in human health with animal health and planetary health. So I'm really looking forward to this collaboration. This is the most pressing challenge of our time. Thank you.
Thank you too. Merci, Ole Peter Ottersen, le président.
Thank you, Ole Peter Ottersen, president of the Karolinska Institute in Sweden. Let's move on to Michel Kazachkin, Special Envoy to the UN. Thank you. Indeed, now we have to think global health. We have seen that a crisis like COVID is also a crisis of governance, of world governance. It is a political and a security crisis. Consequently, the One Health concept must lead us beyond the cooperation of WHO, FAO, AHO. They may sign memoranda of understanding, but we must aim at a high-level reflection on the One Health concept and the interdependence concept in order to go beyond that cooperation. Also, locally, we must integrate that approach in the management of our towns, of our local communities, in order to associate public decision makers with scientists, but also with citizens, citizen groups, and associations, as they have the experience of the interface between man and the environment in the given context. I imagine that the experts will be working on all those themes, but it is important to stress the importance of those two. Thank you, Michel Kazachkin, Special Envoy to the UN. I am now happy to welcome Professor Carlos Goncalo das Neves. You are Research Director at the Veterinarian Institute in Norway, the Norwegian Veterinary Institute. How can one bring this One Health concept to the political agenda? How do you think this should be done, and how will you deal with this project within your group?
Bon après-midi de la Norvège et merci pour l'invitation.
Hi everyone from Norway.
It's no longer a new topic. For most of us, it's something we've been burning for many years. But what COVID has perhaps shown us, finally, is an alignment of different stakeholders acknowledging that One Health is relevant. Politicians, private sector, industry, financial, people on the streets. This is the time to act. But these alignments don't last long. So it is extremely important that we stay on course and we actually now provide those who have the power to decide with a united message. So how do we address politics here and politicians? With a united voice. And there is no doubt that there is a lot happening. As we speak, ESOC is now sitting in the United Nations. We will have Kunming, we will have COP26, the Food Summit. Several initiatives are taking place and will take place in the months and the year to come. And One Health has made it there. So now we need to give these people a joint united plan. And suddenly One Health is something everyone wants to do something about. So I hope this platform and the work in this group can help provide a united vision to these people that have the power to make a change. But let's be honest, if they do make a change, this will be a transformative or a disruptive change, and it will cost money. And this takes me to the second and last point I'd like to make today. This means that the best way to ensure politicians stay on course is to have everyone with us. The people there out in the streets, the private sector, the financials. And this takes me to education and awareness raising. And the power of media. If 30 years ago education was for parents and for teachers to do, today the digital solutions make news run faster than ever before. We are launching this platform with Euronews, not on a joint publication on Nature or Science. Media has to no longer be just a vehicle to explain something, but a constructive part of this One Health plan. You can help us put the facts out, but as we've seen in COVID and in this infodemic, fiction runs as quickly and spreads as quickly as the virus. So let's take you also, all of you media, on board with this one single solution for a One Health challenge. Merci.
Merci à vous.
Thank you to you, Professor Carlos Goncalo das Neves. Indeed, Eric count a new lever, the role of the media to involve the media so that the message is spread. Our last guest is Hélène Delille, Professor Emeritus at the University of Montreal. What lever should be used in order to move this One Health approach forward?
Well, first of all, thank you very much for inviting me. It's a pleasure to participate in this fantastic forum launch of the program. Do you hear me?
Yes, of course. Tout à fait. Nous vous entendons très bien, Hélène.
Merci, merci. So I hope to be able to contribute to this challenging working group through my past experience in training, in research, in communication, and in field action in nutrition at the interface of agriculture, food, and health, of course. In my view, what's needed is renewed awareness, renewed thinking, and renewed action. Now, several aspects have already been mentioned, including the 6 pillars described by Dr. Comte. So I'll be very brief. Renewed consciousness requires sustained advocacy at all levels to make people more aware of the urgency of action at all levels. Urgency of change. Now, what's more important in my view is the need for renewed, innovative, creative thinking. Why not lateral thinking, according to De Bono? Not only going beyond silo thinking, but also beyond system thinking to move toward trans-system thinking. How can the main systems involved in OSH better work together? In particular, agriculture and food system, environmental system, and health system. How can these still separate worlds, public, private, of course, but government, intergovernment bodies, foundations, coalitions, academia, NGOs work together? All these have to be represented in our group. I would think that it was easier, in my experience, to achieve collaboration and intersectoral action at community level, micro level, more than at a more global level. So if you're up to the challenge, join our group. The third point is renewed action. Of course, there's an abundance of ideas, platforms, conventions, agreements, objectives, targets, policies, strategies. The task is likely to prioritize those approaches, actions, and tools that appear most effective at global level, and in particular, those that reduce inequities. And this can be better done in the light of policy and implementation research, which needs to be sustained. Thank you very much.
Voilà cet appel d'Hélène Delille, une nouvelle vocation pour que de
That was the voice of Hélène Delille advocating the work of this 5th group and asking all of goodwill to join the group. The different guests actually have identified different ways to work. The guests were Eric Cantolo, Peter Anderson, Andrea Winkler, and Carlos Goncalo das Neves, and last but not least, Hélène Delille. Thank you. Let's move on to group number 6.
Voilà, de retour sur le plateau pour ce groupe de
Back in studio. This is the sixth group. How to develop one sustainable health practices and resilience within indigenous and other local communities. We have seen already the importance of working with local communities and how important it was. I am happy to welcome Dr. Kamel Moana, welcome. And Antoine Lurie.
Bienvenue également. Je vous laisse vous installer. Nous discuterons dans quelques minutes ensemble.
I will be back with you in a few minutes, but first of all, our guest is in duplex. It is Eva Furman. Hello, Eva. You're the director of the Finnish Institute of Environmental Studies. How do you intend to work with this sixth group?
Alors, je crois que nous avons
Eva, could you switch on your mic?
Peut-être l'activer. Et c'est Eva, excusez-moi. Est-ce que vous nous... Voilà, alors je crois qu'il faudrait que... Alors, je crois que vous ne nous entendez pas et nous ne vous entendons pas non plus. Est-ce que vous pouvez activer...
Eva, can you hear us? Maybe you need to switch on your microphone. Okay, you can hear us, but we cannot hear you.
Alors, on me suggère que vous débranchiez votre oreillette de votre ordinateur pour parler directement.
Okay, maybe you can disconnect your headset from your computer and maybe use the speakers of the computer directly.
Et le débrancher de votre ordinateur.
Disconnect it from the computer. Not only from your ears, but from the computer.
Alors, malheureusement, nous avons un problème de votre côté et nous ne vous entendons pas.
We
Ce que je vous
still
propose,
cannot hear you.
Peut-être essayer de résoudre ce problème de
Why don't you try to find a solution and we'll get back to you in a second. I hope that we'll be able to be back with you in a few minutes. So, Antoine Lurie, you're the One Health and International Partnership Program for Veterinarians Without Borders. How do you intend to launch that concept?
Donc, le concept One Health n'est pas nouveau pour nous. Donc on
It's not a new concept for us because we're an NGO and made up of veterinarians and agronomists. We have worked with on a variety of projects, and we have always worked in such a way.
Et parce que par le volet agronomique, on est très engagé dans la transition écologique.
Committed to ecological transition, and it's a theme that we've been working on for a long time. There's still a lot to do. We have developed tools, but we need to go beyond, and we need to establish partnerships with scientists, with donors.
Globalement, ces dernières années, je peux illustrer.
Globally, I can tell you that two projects were key over the last years. A project in Mali since 2005. It's a co-ed mobile caravan with a doctor, a veterinarian, a nurse, and a guide. And they go around northern Mali, even today, for primary care and to work with prevention and how to work early with malnutrition and how to answer upstream from a crisis. It's a scheme that is accepted within Mali and also within the Algiers Peace Accord. We go from village to village and we bring people's attention to human, animal and environment health health, and concretely, they are transformed into collective actions. And we have created community health days where we bring the people of the villages together and we try to work with them, with community agents. Usually they are experts in human, animal or environmental health, and we bring them to work together. A lot is at stake. Local communities need to be involved. Local authorities need to be involved because everything seems to be centralized. It's the top-down approach. And it is interesting to note that cooperation and coordination is sometimes much more efficient at the local level than at the central national level. Another point that is important is the multi-scale partnership. It is important to work with other actors, with other NGOs, with other partners in order to co-build. I understand that a lot of concepts have been developed over the last years, but there's still a lot to do. The environmental notion must be integrated. The territory health is also to be integrated. So it is the global sense of health. We need to work in partnership with researchers, and we need to develop tools to understand what we do.
Et j'ai un petit trou. Vous étiez sur la présentation de ces deux projets et de ces différents moyens d'action sur la coopération qui était très importante entre les...
Okay, you were telling us that it was important to work in collaboration with local authorities. Yes, but I wanted to say that it is important to analyze the change of practices in order to work with local communities. We need to understand the levers and the different roadblocks for them to understand, to participate in surveillance systems. Why would it be that they can't or that they would be willing to? The final objective is to have the capacity to experience in the field and to have solid references, solid data in order to help the decision-making process. The partnership we have at the moment is too centered. It's not only state science, it should be state science society. Indeed, there seems to be a consensus within the OHS Forum. Next report is actually a report on your organization, AML. Between 2021 and 2023, the TLL project will intervene.
Pour opérationnaliser le concept One Health. Le choix du département de Vélingara comme zone d'intervention du projet se justifie par le fait que c'est une zone importante de production de coton avec une forte utilisation de pesticides. En plus de cela, c'est la deuxième région d'élevage au Sénégal avec des éleveurs qui font de l'automédication en utilisant des produits qui souvent sont issus du trafic frauduleux des antibiotiques. Cette utilisation d'antibiotiques non contrôlée se retrouve aussi en matière de santé humaine, Concrètement, la stratégie proposée s'adosse à une démarche participative et intégrative de l'ensemble des secteurs. Nous comptons travailler avec les acteurs professionnels, que sont les médecins au niveau département, mais aussi les chefs de poste vétérinaires, les infirmiers, les relais, les auxiliaires, des acteurs de l'agriculture, pour qu'on puisse ensemble, à partir de groupes de discussion au niveau des villages, identifier les problèmes liés à l'utilisation des produits chimiques. L'ensemble de ces problèmes vont être validés au niveau communal avec la collectivité territoriale et l'administration territoriale. Le projet Tchelal offrira donc à ces acteurs l'opportunité de s'adresser à la même cible en même temps en tenant compte de la diversité des facteurs pouvant influer sur l'utilisation de ces produits. Le projet va appuyer des actions de sensibilisation en s'appuyant sur les radios communautaires. Le projet a prévu de mettre en place des champs-écoles qui pourront permettre de comparer deux types de cultures, des pratiques conventionnelles et des pratiques basées sur les bonnes pratiques. En élevage, ceci va se faire au niveau de troupeaux qui pourront bénéficier d'un accompagnement en termes de biosécurité.
Voilà cet exemple très concret d'action
a concrete example in the field, the TLL project in partnership with Soltis.
Je me tourne maintenant vers vous, Kamel.
Now, Kamel Moana, you're the founding president of AML International. How will you act within this group?
C'est un modèle justement pour qu'il y ait dans le monde une santé durable,
to reach a sustainable health
des changements pour une santé pour tout le monde.
For everyone. Unfortunately, in this world, poor are getting poorer and rich are getting richer. And after COVID-19, we discovered how much the medical specialists are marginalized. So it is a lesson for all of us. And even the World Health Organization launched the Health for Everyone concept. We realized that not everyone has access to healthcare. So HAMEL is a great NGO in the Lebanon. It's non-denominational organization in a country where the political organization is religious-based. We have over 1,000 full-time employees, and our slogan is how to develop the humanity of humans without taking into account their religion, their politics, or their country. We have not chosen our family, our nationality, our religion. We inherited them. So what we can do together is a real challenge. 55% of the population lives below the poverty level. We have 1.5 million Syrian refugees. It corresponds to 22 million in France, pro rata. And so it is difficult. And at HAMEL, we are setting an example. It is a model of health centers as selected by the Lebanese Health Ministry. The Health Ministry says we are the best in the Lebanon. So it is the hand from above. It is solidarity and not charity. I am a specialist of infant diseases, and we have been trained to treat diseases, not to prevent them. So we need to think differently. 100 countries do not have access to the vaccine. And even at the UN, after the fall of the USSR, voted for the sustainable development. And despite all the speeches on culture of law, the empowerment of women, we have 2 billion poor people and 500 billionaires. And 26 people in the world possess half of the wealth of the world.
J'ai écrit un livre récemment sur la réforme de la santé.
I have recently written a book, and I am the president of the Lebanese NGOs. And the question is how to treat people as humans and how to give them human dignity. I believe this is what is lacking in the world. Even in the Western world, we have homeless people. We have a minority getting richer and a majority getting poorer. So that initiative of my friend Benoit Bernal is part of this initiative in order to advocate a fairer world. Kamel Moana, in order to make your speech more concrete, I would like to watch a video presenting your work in the Lebanon.
Hamel Association International
Hamel Association International is a non-denominational organization founded in 1979 after the first Israeli invasion of South Lebanon. Our slogan is how to develop people's humanity without taking into account their religion, their politics, or their country. We have not chosen our family, our nationality, our religion. We inherited them. What we can do together is a real challenge. Hamel here in the Lebanon is a non-religious based organization with 28 centers, 6 mobile clinics, 2 educational mobile units, 1 street children protection unit. We employ 1,100 full-time employees. 85% of them are young women. Hamel is managed by young people, and it has grown internationally in the USA, France, Belgium, Switzerland, Africa. We work for human dignity. The One Sustainable Health movement is interesting as it reflects our philosophy of the right to health. The services we provide in our centers are quality services based on solidarity and not charity. It is not a hand from above. We are aiming at a development with the people and not in the name of the people. We are promoting prevention, the culture of law, especially the right to health. We provide 20,000 medical consultations every month. Our primary care centers are deemed by the Lebanese Health Ministry as the best in the Lebanon. They are a model for change in the Lebanon and other countries. It is interesting to work together in South Lebanon as partners. Avoiding the neo-colonial culture teaches us how to work and advocate the right to health and a fairer and more human world.
Et nous continuons la découverte de nos invités.
We have more experts to join us for this 6th group. I believe we can now hear Eva Furman. Eva, can you hear us?
I can hear you very well. Can you hear me?
Parfaitement. Quel va être votre rôle, Eva?
What will be your role within group number 6?
Yeah, so the role of the sub is very much on bringing the local level and the communities on board. So actually what is new with OSH that hasn't been talked here so much is the S, and that's for sustainable development. And why sustainable development is so special, it's that it is for a safe and just world for all, for local level, for everyone. And it really aims for the earth and the people to become together and do a systemic change. As we have heard a lot, very interesting talks and presentations, there's a lot of policies, there's lots of thinking, but what really matters is what happens on the local level. This is what science shows. Something else where science can really contribute is how to do it, how we actually support this change. How can we change towards a shared planetary health, where humans' ecosystems are together and where innovations are done? There is also research which shows that actually innovations on local level are most productive for sustainability. And that's what OSH is about. So we need to learn how to actually develop new practices. We need to know how actually to find ways to change the behavior of individuals, but also on local level, there's lots of institutions. There's lots of businesses, municipalities, healthcare centers, schools, recreation, sports. All of these need to be taken on board. And we really need to learn, all of us. We need to learn at school, at home, and in all different activities in communities. And we do this with facts, scientific facts, but also with storytelling, with culture, with art. And women play a really key role, although we need everyone. But it has shown that women have a very important role in the societies because we have very many generations and we have the homes. So in addition to this, the youth and the children are also in a focus area. And we do all of this so that we create active citizenship, a dialogue, and also experiment the new ways what OSH really requires. And this is the way to actually to create capacity for the OSH for the future. I'm also looking very much forward to the other people in the group and invite everyone and those who find this interesting to join OSH and the group 4. Thank you.
Merci pour cet appel. Eva Furman, je rappelle que vous êtes
Eva Furman, manager of the environmental policy of the Finnish environmental policy. Our last guest is Dr. Amidou Nianganu. You are joining us from Mali as a researcher. How will you join in this group?
Thank
you for your invitation. I am leading the Malaria Research and Training Center, and we are used to working with in a cross multidisciplinary way. And we have focused on such a way of working. We have developed the capacity of working differently with people from Mali going to different schools and developing different skills. We have anthropologists, we have doctors, and so on. And the multidisciplinary approach is not novelty. And we are working in collaboration with the sanitary authorities, the health authorities, in order to bring new ideas. In Mali, our concept is quite well structured. We have One Health concept that is quite well structured, but the objective is for this concept to be transformed into reality. I am happy to join group number 6 And we have great experience in working locally. For example, we had problems with various illnesses here, so we developed a way to reach out to them, and it has worked quite well over the last 20 years. For other illnesses, we have to work with the communities, and we have to get those people involved from the very beginning so that they analyze and realize what the problems may be. Within this initiative, we can also bring funding, because in developing countries, funding is not enough. So we need to develop local initiatives, and we are currently testing a local strategy, which is to bring the communities to pre-finance health initiatives. Our participation to the 6th group is to share our vision to find long-term responses to those challenges. We are very happy to be members of this group, and we will do our best to find solutions. Thank you.
Merci beaucoup, Dr. Hamidou
Niangali,
chercheur associé
Dr. Hamidou Niangali, MRTC Researchers.
Groupe 6, je rappelle le nom des invités.
So, our Group 6 is represented with
Dr.
Kamel Mohana, Eva Furman, Antoine Lurie, and Hamidou Niangali. That's all for the 6th group, and we're reaching time to conclude.
Et nous sommes de retour sur le studio, sur le plateau.
Back in the studio for the conclusion of this OSH Forum. We have seen the presentation of the 6 groups. I would like to welcome back Fabien Quintard
and Max Claro. Fabien Quintard, vous êtes coordinateur donc de ces groupes.
Fabien Quintard, you're the coordinator of those international working groups, and Max Claren, you're the project manager of this One Sustainable Health Forum.
C'est plus simple parce que j'ai toujours du mal avec ce S de sustainability. Si on le dit vite, ça marche pas. Alors, quelle est la conclusion que vous allez apporter à ces groupes de travail?
What would you like to share with us? Concretely, what's going to happen?
Bonjour Edwige, je vais le faire plutôt en anglais pour des questions de traduction.
Très bien.
So what we have to say is, in addition to the 6 thematic working groups that we've talked about all this afternoon, we'll also create a seventh one, a collective group that will discuss the common vision and a common approach for One Sustainable Health. So we have nicknamed this group 6+1 because it will be made, we don't want to recreate silos, so it will be made of the 6 co-chairs of each working group plus the members of the Scientific Advisory Board. And they will discuss every month to ensure a consistent flow of information between the groups, and we will try to ensure a common vision through this process. So the first thing to say is that we will have these 6 thematic working groups, and in parallel, a 6+1 group. And concretely, 5 deliverables are expected from these working groups. The first one is advocacy, to promote a global vision and integrated approach to one sustainable health. The second one will be to deliver concrete recommendations and propositions for projects, because we want, as has been said until now, really operational implementation of the concept of one sustainable health. We'll work also on a research agenda because we want to boost interdisciplinary research. We'll work also on education because we want to raise awareness and facilitate behavioral change, and that can only be made through education. And last but not least, we'll also work on ethics to create common values. So there will be 5 deliverables for the 6+1 group: advocacy, recommendations, research, education, and ethics. So globally now, I will soon leave the floor to Max, but we're in the process of constituting these international working groups. So the process is open to everyone who has an interest in it, so please express your interest. The expected commitment is more or less half a day of work if you count 1 monthly meeting plus, let's say, the discussions through emails, essentially, until the World Health Summit in Berlin in October 2022. So the process is open. Please express yourself. Please express your interest, and the organizational committee will then define the core group, taking into account the need for good balance, geographic balance, interdisciplinary balance, balance in the roles taken, gender balance, etc. So Max will now tell us how you can express your interest to participate in these international working groups.
Yes, thank you, Fabien. So on a practical side of things, you will have an expression of interest form to fill in. It will be, we'll ask for details such as your personal, professional experience, expertise, whether you are part of an international organization, and what kind of discussion you can bring to the group, along with your nationality, to ensure that balance that we want among the groups. And so those will be sent and available on the website, the OSH Forum website, and through our newsletter that will be sent out next week. And then we'll aim to have a core group of a few experts, not the groups finalized, to have a first meeting by the end of this summer.
Merci pour ce calendrier.
Thank you for this timeline, for this great explanation and this call for tender. That was the objective today. The objective is to have as many experts as possible so that they share their knowledge, expertise in order to reach our objective of one sustainable health. Gentlemen, thank you very much. Fabien Cantar and Max Claren. We have another guest, that's Axel Priss, who is the president of the World Health Summit, who is of a great support.
Ladies and gentlemen, dear friends, I warmly welcome you to the One Sustainable Health Forum held today. Unfortunately, I was not in a position to attend this meeting physically, but I'm supporting the meeting for the World Health Summit wholeheartedly. The One Sustainable Health approach is a holistic approach which takes into account not only the individual human health, but also the health of animals, of the environment, and everything which lives on the planet. In the end, sustainable health can only be achieved if we look into all these dimensions, and all these dimensions strongly interact. This has been made very clear again by the COVID crisis, but it's a fact which follows us every day. Therefore, I think the basic concept of the One Sustainable Health Forum is very much justified, and therefore it's also very much supported by the World Health Summit as a partner institution. Therefore, I wish you a lot of success in your meeting and a lot of success in putting your viewpoint on the international agenda. Thank you very much.
Le professeur Axel Ries, président du World Health Summit. Un autre soutien de cette initiative OSH Forum, c'est le Geneva Health Forum.
We have also the support from the Geneva Health Forum, and we have Antoine Flau, who talking to us from Geneva. Hi, everyone. I am thrilled to see that initiative take place. It is rare enough to see professionals of different sectors who often work in silo actually work together. We have health professionals, veterinary and international organizations, foundations, public and private sectors, partners actually work together. You now have 16 months to work on this One Health initiative. We are all convinced it's vital to prevent awful pandemics like the one we currently face. I hope the Geneva Health Forum will be able to present the preliminary work of the OSH initiative when it convenes next May in Geneva. I'm happy of the long-standing cooperation with the World Health Summit, where the final version of the OSH Forum will be presented in October 2022. Thank you. I wish you great and fruitful discussions, and I look forward to welcoming you in Geneva next May.
La conclusion d'Antoine Flau, le président du Geneva Health Forum. J'accueille maintenant nos derniers invités sur ce plateau. Michel van der Rest, bonjour.
The conclusion of Antoine Flau and my last guest are joining me.
Vous êtes administrateur de la fondation.
You are administrator of the Bulukin Foundation and Professor Emeritus at the Lyon University. Welcome. We have been presented the 6 themes. What is your conclusion?
Arriver à une approche globale de la santé durable pour tous.
Pour la Fondation Bulukin, c'est d'abord.
For the Bulukin Foundation, it's a great opportunity to be associated with such an opportunity. So the foundation thanks Bruno Maribel to have asked the Bulukin Foundation to be the umbrella foundation. The Bulukin Foundation is rooted in Lyon because of one man who represents the story, the base of the One Sustainable Health approach. It's one man who was sold as a slave during the Armenian genocide, who ended up crossing the Mediterranean and making a great life here in Lyon. And the objective of our foundation is to develop medical research and bring aid to Armenian people. So our objective is to carry on and to develop that that project that was started 40 years ago. So indeed, the Bulukian Foundation is the umbrella foundation. It's in our genes. We have to actually aid the public. Isabelle Varksmut, I hope I'm pronouncing your name right. What is your role and how will you intervene?
Pour nous, c'est essentiel d'être dans cette de faire partie en fait de cette initiative.
In fact, we have to be part of this initiative because we need to reinforce the advocacy calls, but also all stakeholders and the representatives of civil society for universal healthcare. And we want to bring together health services that are integrated so that they can actually work from A to Z. And we want to have an approach that is centered on this approach, and we want the human being to be centerfold, and we want the individual to be able to decide what to do to remain in good health. So we have heard different solutions about nutrition, about environmental protection. Those are key to remaining in good health, and this can only be done internationally through a multidisciplinary approach. So this initiative of One Sustainable Health is a great gas pedal in order to move forward. I now welcome Benoît Miribel to come and conclude this presentation.
Vous avez fait l'introduction et vous êtes là pour la conclusion.
Okay, well, you introduced the forum, so now you have to conclude. And indeed, when you conclude, you have to say thank you to all the partners, those who are committed. What I have done is only to listen to professionals. As Dr. Kamel Moala, it's the White Army, first of all, the ones on the front line, and also fighting neglected tropical diseases, and stepping back and asking questions about what we can do. Here, I believe we can see the logos of all organizations that have joined us. We have seen representatives of those actors. We have two pillars. We have the experts who will speak without their hat on, and they will talk specifically about what can be done. And then we have the organizations that are structures, and they will establish a dialogue with the experts, and they will tell them, what is possible, what is not possible. It's the feedback from the field. And during 16 months, this is what will happen.
Donc, en fait, on a ce forum grâce aux partenaires. Je tiens aussi à remercier.
And this forum is here today because of those partners, also because of the Bulukian Foundation, but also Daniel and Nina Faraso, With them, we actually created the funds and French foundations for the fight against climate change. We have the Fondation de France and Veolia Foundation. We are aiming at an approach for the public. We are launching the working groups, and we are actually asking you to come and join us in Berlin. And till then, every month, until 2022, you have the opportunity to make concrete suggestions and proposals. Thank you, Edwige Coupé, to have accepted and to come with very little time to present. Thank you for the logistic help. Thank you to Euronews. And Julia Meleshenko was great. Lionel Laval, Damien Gerrier, production manager with Elsa. The whole team, I don't have all the names. Lionel Laval, Damien Gerrier, and Elsa Pardo-Garcia. Thank you to all of you. Great technical team. We are moving on because people are involved. The World Health Summit with the Geneva Health Forum. And the first one to commit was Detlev Gantlev, the founder of the World Health Summit. Detlev Gantlev, a great person. We are at the beginning. We will have monthly meetings. I had a great conversation with Madam Ambassador, with Isabel from the World Health Organization. There are things that are going beyond what we can do, and we need to understand, and we need to think differently. It is not only a prayer, it's a way forward. Thank you very much for this great conclusion, Benoît Mirabel. This is the end of this program, the operational launch of the One Sustainable Health Forum. We are looking forward to receiving your application. Thank you.